All right, let's dive right into this explainer. Today we're unpacking some truly definitive evidence on why autologous conditioned serum, or ACS for short, is completely replacing traditional plasma in joint therapy. If you follow regenerative medicine, you know the absolute holy grail is finding a way to actually halt joint degeneration, right? Not just slap a Band-Aid on the pain. Well, as you'll see today, we're looking at a massive shift in how we actually achieve that, moving way beyond simple plasma spins and into the realm of highly engineered biological serum.
So here's our quick roadmap for today. First, breaking therapies and biological engineering. 2, blocking inflammation and the clinical proof. 3, debunking the slow-release myth. And finally, the future of orthobiologics. Let's get to it.
Starting off with Section 1, breaking therapies and biological engineering. Basically, why are standard treatments falling short, and where exactly did this new solution come from?
When we look at a direct comparison between standard platelet-rich plasma, or PRP, and this biologically engineered ACS, the difference is just staggering. I mean, the bioactivity and clinical efficacy are on a completely different level. ACS pushes back against joint degeneration in a way that PRP literally just can't. But to really get why that is, we kind of have to take a hard look at what we've been doing wrong up until now.
And the harsh reality is, current intra-articular therapies flat out fail to alter the actual biological progression of things like osteoarthritis. Think about it. Corticosteroids, they only mask symptoms, and honestly, they can actually accelerate cartilage degradation over time. Hyaluronic acid is essentially just mechanical oil. There are zero active biological healing signals there. And PRP? Well, it relies on a super unpredictable slow-release mechanism, requires anticoagulants, and it even retains coagulation factors that bring a risk of thrombosis. The bottom line, none of these are fixing the underlying biological environment.
Now, the origin story of ACS is actually really fascinating. Back in the 90s in Germany, researchers developed this before PRP was even a big thing. But its real proving ground? High-stakes equine sports medicine. And here's the thing about treating elite racehorses. You absolutely cannot give a horse a placebo effect. Treating severe lameness in these million-dollar animals demanded rapid, undeniable biomechanical recovery. It was only after ACS completely proved itself in that incredibly rigorous environment that it got its official GMP certification for human use back in 2001.
So how does it actually work? This brings us to the biochemical factory itself. You start by drawing whole blood, completely free of any anticoagulants. Then, that blood is introduced to these specific sulfate-coated beads. And here is the absolutely crucial step: incubation. For 6 to 9 hours, these beads mimic a severe inflammatory environment. This literally tricks your body's white blood cells, the monocytes, and your platelets into just mass-producing healing proteins. After a quick spin in the centrifuge, you're left with this golden serum that is entirely cell-free and ready for injection.
Moving right along to Section 2, blocking inflammation and clinical proof. We've seen how it's made, so now let's dive into the raw biochemical power it produces, and most importantly, the hard clinical data that proves it works in patients. But before we even look at the charts, I want you to just keep this massive number in your head. 190 times. 190 times the baseline concentration. Because that 6 to 9 hour incubation we just talked about, it triggers a massive multiplication of critical growth factors. For example, PDGF-AB, which is a crucial healing factor, experiences a mind-blowing 190-fold increase compared to baseline. We also see these huge spikes in vessel and tissue-building proteins like VEGF and HDF. It delivers a massive, full-dose, cell-free biochemical payload. And the best part? The inflammatory markers stay negligible. So the process is stimulating incredible healing power without setting off systemic inflammation. What's really cool is how ACS actually physically blocks the inflammatory signal right inside the joint. Normally, in baseline osteoarthritis, inflammatory proteins are just chewing up the joint. But ACS delivers a massive 8.5 times increase in a natural antagonist called IL-1R. And this acts exactly like a key plugging a lock. It literally blocks the receptor so the inflammation can never transduce its destructive signal.
But let's translate that biology to actual human patients, because that's where it gets truly exciting. There's this massive 1,000-patient retrospective study showing that 70% of patients achieved immediate, significant improvement in pain, stiffness, and function. But it's the longevity that's the real game changer here. 35% of that cohort maintained their total pain reduction and functional improvement for about 3.5 years. That is huge. And just to be absolutely sure this isn't some placebo effect, rigorous randomized controlled trials confirm it. ACS shows a super rapid onset of efficacy by week 7, and it sustains that peak improvement well past the 2-year mark. It completely leaves standard lubrication therapies like hyaluronic acid in the dust.
When you break it down mathematically, ACS vastly outperforms traditional pharmaceuticals and orthobiologics across the board. Look at this effect size chart. An effect size of 0.73 for pain reduction with ACS, that completely dwarfs corticosteroids, HA, and even PRP, which is sitting way down there at a mere 0.40. The exact same trend holds for functional improvement. The math is just undeniable.
All right, Section 3, debunking the slow-release myth. To really grasp why ACS wins so decisively, we have to bust a major myth in regenerative medicine that has honestly held the whole industry back for decades.
So the golden question is, why does serum dramatically outperform plasma? Well, it all comes down to the fundamental biological constraints of PRP. Sure, PRP is super fast to make, like 10 minutes, but it's biologically handcuffed. It requires anticoagulants and relies on intact, unbroken platelets. ACS, on the other hand, takes that 6 to 9 hours to produce, but it yields a fully activated cell-free payload.
Actually, think of it like driving a car. If you're trying to accelerate out of a dangerous situation, you press the gas pedal to get immediate, full engine power, right? You definitely don't want a slow, staggered release of speed trickling out over weeks, yet that's exactly what PRP is doing. It relies on the slow release, while ACS delivers its full biological power instantly.
This diagnostic matrix really hits the nail on the head. PRP has to use anticoagulants, which not only dilutes the sample but prevents natural clotting. ACS uses 0 anticoagulants. Because of that, the growth factors in PRP are basically trapped inside those intact platelets. But in ACS, the incubation process fully ruptures the platelets, so it releases the entire biochemical payload into the serum right away. And this completely destroys the myth of slow release and biological healing. Traditional logic just assumes platelets should slowly trickle out healing factors over a few weeks. But guys, physiology simply does not heal this way. Genuine tissue repair requires an immediate, massive biological cascade to force that joint out of a degenerative state. ACS delivers all those growth factors up front, hitting the biological on switch instantly.
Which brings us to our final section, the future of orthobiologics. Let's talk about what this massive shift from plasma to serum actually means for clinical safety and the future standard of care.
As the experts so perfectly put it in our source material, in surgery, anticoagulants are our enemy. So we don't want anticoagulants. It's really that simple. By removing them from the equation entirely, you eliminate a major clinical risk that PRP just inherently carries. See, because PRP still contains coagulation factors, injecting it into a tight joint creates a real potential thrombosis risk. But with ACS, the clotting happens entirely inside the incubator tube over those 6 to 9 hours. So all those coagulation factors are completely consumed before the serum ever even touches the patient. The result is an unmatched safety profile with 0 thrombosis risk and literally 0 reported serious adverse events. So we're looking at a very clear trade-off here. Yes, PRP is fast and easy to make, but it gives you moderate efficacy and keeps those clotting risks around. ACS asks for a complex 6 to 9 hour incubation, but, that manufacturing burden is exactly the engine driving its superiority. By taking on that complex incubation, clinicians are able to deliver an entirely risk-free, biologically maximized serum. To quickly summarize our deep dive today, the superiority of ACS is really built on 3 undeniable pillars. First, biological dominance, driven by that massive 190x increase in growth factors. Second, clinical proof, showing mathematical outperformance and years of sustained relief for patients. And third, ultimate safety, by just entirely stripping away the risks associated with anticoagulants. Bringing this whole explainer together, true physiological transformation of the joint environment demands rigorous biology. It's a process that a simple 10-minute centrifuge spin just cannot achieve. When you look at the biological dominance, the clinical proof, and the ultimate safety profile of autologous conditioned serum, it really leaves us with one provocative question. Isn't it time we stop relying on an outdated 10-minute spin and step fully into the future of highly engineered serum?